Welcome to Seagull Maritime's series on elementary first aid. In this video, you will look at the signs and symptoms of shock and consider the 3 shock positions to be used in the event of an emergency. Throughout, you will be asked to pause the video and reflect on what you have seen and heard. Ideally, you should watch this with at least 2 of your colleagues so that you can engage in group discussion.
There are many different forms of shock that you may face as a first aider, including emotional, electric and cardiogenic. There is also anaphylactic shock, which is caused by a serious allergic reaction, and hypovolemic, which occurs when fluid is lost from the body as a result of bleeding, burns or severe diarrhea and sickness. The initial signs and symptoms of a casualty suffering from shock are paleness, cold and clammy skin, and cyanosis, which makes the nose and lips look blue. They may also have a fast but weak pulse, and exhibit fast and shallow breathing. As shock develops, the casualty may become dizzy, nauseated, or they may show signs of air hunger by yawning or gasping for breath. They may also become anxious, possibly with aggression, and show signs of lowering levels of response. If the shock is not dealt with, the casualty may become unconscious and die as a result. As there is no treatment for shock, you must treat the cause. Stop any bleeding, cool and cover burns, and lay the casualty down, loosening any tight clothing, and keeping them warm. Do not give them anything to eat or drink, as this can cause further complications, such as vomiting or delays to any operation that may need once ashore. It's also essential you do not allow the casualty to smoke, as this will increase the effect of hypoxia, which happens when the body is deprived of an oxygen supply.
What should you do if you find a casualty suffering from shock but are unable to identify the cause? Click the pause button and start your discussion.
Remember to assess injuries before moving the casualty and place them in the correct shock position relative to their injuries. Used for most injuries, shock position 1 reduces blood flow to the lower limbs and encourages blood flow to the brain and other major organs. Place the casualty in this position by laying them down with their head low and their legs about 30 centimeters off the ground. Used for casualties with a head injury, shock position 2 reduces the blood flow to the head. Place the casualty in this position by laying them flat with their head and shoulders raised. Shock position 3 is used for any casualty with a chest injury or difficulty breathing. It concentrates blood flow around the major organs, whilst also making breathing a little easier. For this, place the casualty in a half-seated position, with the legs bent in the W position.
Why is it important to place the casualty in the correct shock position? What could be the consequences of placing them in the wrong position? Click the pause button and start your discussion.
It's important to remember that there is no treatment for shock, other than to remove the cause. As a first aider, it's your responsibility to deliver effective treatment to the wound that has caused the shock and do your part in treating the casualty.